What's up, Instagram? How about we talk stem cells with a friend of mine, Dr. Harry Adelson from Docera Medical, who's done a huge amount of work on me. I'm going to invite him in. We're going to learn some stuff about stem cells. I've had a huge amount of upgrades that way. So if you want to know what's going on there, I'm going to make it worth your time. There he is, Harry. Look at that. He just pops right in. Harry, my friend, good to see you.
Dave, nice to see you.
You're going to be speaking at the Biohacking Conference on the 8th, by the way, guys. Go to biohackingconference.com. And I want to do an IG Live with you to just catch up on what's the latest stem cell stuff going on because, well, lots of fans on here, lots of people saying hi. And if they've read my books and all, they know I've had stem cells pretty much everywhere you can put them, including some places you can't put on Instagram without getting banned. What have you been doing that's new? Here's a question about type 1 diabetes stem cells. Just tell me the latest.
Well, there's stuff we've been doing that's sort of more of the same, and then there's stuff that's coming down the pipe that's absolutely new. So we're doing a ton of full body, and we actually just did 3. Amy Killen and I just did 3 in 3 days. And I'm sorry that she couldn't join us, but she had to run off. She's taking a class on blockchain. What a stud, huh? So anyway.
That's awesome.
I know. But she had to take off, so she couldn't join.
Okay. Well, I support the blockchain as well. And pretty soon there'll probably be someone making a stem coin, which is somehow related to stem cells. A couple of people who don't know what stem cells are, who are probably new followers. So these are basically parts of your body that are naturally present. You have more when you're younger that grow and they stop inflammation. They actually can help you make new parts of your body. And what Harry does is he takes some from some places and puts them in other places so that you can have a body that's younger and stronger than it's supposed to be.
Yeah, because our body's comprised of cells, and we have heart cells, and we have liver cells, and we have lung cells, we have muscle cells, we have brain cells, and then we have these other, those are all cells that organs, but then we have other cells that exist throughout our entire bodies, like our red blood cells and our white blood cells, and of the white blood cells, there's different categories. And then we have these stem cells. We have these mesenchymal stem cells. And mesenchymal stem cells exist in virtually every tissue in our body. And their role is to maintain the health of their microenvironment. So whenever you have a type of injury at all, these cells activate and have the ability to interact and communicate with the surrounding cells. They launch the healing cascade, essentially. So whenever you have healing after injury, it's a stem cell mediated event. Well, what I started doing 10 years ago after I had done regenerative injection therapy and PRP for 10 years, I learned how to aspirate bone marrow. And bone marrow is a very rich source of these mesenchymal stem cells. And when you take these stem cells from tissues like bone marrow, fat, and you inject them into an area that's undergone suboptimal healing, the tissue either from like chronic use or from an injury that's never completely healed, the microenvironment is unhealthy. There's the collagen fibers are irregular, the microcirculation. Well, if you inject these mesenchymal stem cells, tricking the body into thinking that you've endured a new injury, but you haven't, and it thereby launches the healing cascade, giving you a chance at healing without having actually been injured.
Here's a question from Dale Myers here. He's like, why not use placental cells? Why using your own cells? I mean, that's in some of the books, but I think for people listening, okay, you could get stem cells either for anti-aging or because you have an injury that won't heal or your brain isn't working right. There's all sorts of reasons to do it. So, okay, why, what should people think about there?
There's a couple of reasons. I just personally don't really want somebody else's genetic material because we don't really know the long term.
Yeah,
but we don't know. I found that that using stem cells from your own body for treating musculoskeletal pain, low back pain, neck pain, joint pain, works very well. Now I do supplement with exosomes. And exosomes are the growth factors from placental stem cells. So you're getting sort of the active ingredient of placental stem cells, but these exosomes, which is a cellular fragment, have been separated from the cells, so you're not actually taking in the other person's material.
There's something powerful if you're dealing with a really a disease that could kill you. You're saying, all right, it's worth the risk of getting 8 different people's placental cells,
Exactly.
right? But if you're dealing with long-term anti-aging, I'm a little sketched out because there's all sorts of viruses and other stuff that we probably don't even know about and certainly aren't screening for. So
Yeah.
I like the idea of taking my own stem cells, and you've tapped into my bone marrow twice, once without any, I was awake the whole time, and certainly gotten my fat cells and all that. And I only passed out once, but it wasn't because it hurt. It was just kind of weird. 3 times. You've gotten 3 times? Oh, okay. I only remember 2 of them. I guess I was passed out for the other one. But so you take those out and you put them where they need to go. And guys, just full disclosure, there's videos on Harry's site, on my site and all. I've had my stem cells. Harry took them out, and I've had them put in my face, my hair. I mean, look at this amazing hair. I've had other stuff done to my head, but also in my reproductive organs, for lack of a more fruitful term, and every joint in my body, all along my spine. And it's pretty incredible, just the long-term rejuvenating things compared to getting joint replacements, or in my case, I had some injuries even from sports when I was a teenager that hadn't all the way fixed themselves, and it really made a big difference. So yeah, it's relatively expensive now, but compared to most of the medical procedures you get, it's not relatively expensive. It's cheaper than getting a knee replacement, for instance.
Yeah, it's about hair restoration. You know, what you're describing there, Dave, is full body stem cell makeover, which I developed for you. And so the way
that was cool.
out was from, like 2014, busted up cowboys, ranchers, farmers, and oil field workers, a lot from Western Canada, a bunch from Wyoming. These people who really have arthritis in the entire body. So I would do big treatments. I'd do their entire spine, every level, shoulders, both knees. And I sort of started calling it full body stem cell makeover. Well, then you became a patient, and I started following. And people, well, can't you just prevent full body single? And I thought about it, and I thought, yeah, good. So we came up with it. You were the first to it.
I was the guinea pig.
Of course.
Look at me. It worked.
No
one knows I'm 80. Your audio is cutting out. I thought it was just me. So you might need to get closer to your thing. Apparently your sound is having an issue. Sorry, guys, on the rapper sounds. I was actually getting a prop. I'm going to show you guys this prop in a second when I ask him a question.
Yeah, what were we talking? Whole body.
Whole body stem cell makeover.
Yeah, so that's and what we do for that is we do sort of my traditional kitchen sink approach, which is stem cells from your bone marrow combined with stem cells from your fat, then supplemented with the placental exosomes. And so what we think happens is we take your old stem cells, supplement them with the exosomes. We think your own stem cells absorb those exosomes into themselves, thereby functionally making your stem cell that of a younger person. When we started this conversation, you asked me what's new and exciting, and it's V-cell.
Yep.
Hot new thing, and I've heard about it for about a year, and then it was so funny because I said I have got to learn how to do this. I've got to get up and going with it, and then you called me and said I've got a guy, Dr. Todd Olkovi. Let's see if I can pronounce it. Ovokates.
Yep.
And he's developed a way to activate V cells. So what are V cells? VSEL.
They're not V cells. Everyone thinks this. I see a comment from KJ Greenway there. It's VSEL. It's not V-cell because it stands for something. Tell them what it stands for.
Very small embryonic-like stem cells. So these V cells, these very small embryonic-like stem cells, they're called very small because they're actually smaller than a red blood cell. They exist in our peripheral blood, but they're quiescent, meaning they're just basically hibernating or asleep. But when they get activated, they are the most primitive stem cell in the human body. They're called embryonic-like because the embryonic stem cells, which we don't use, are the most primitive. And then the mesenchymal stem cells are kind of down here. Well, the very small embryon, the V cells, are kind of in between, right? They're very primitive. They're so primitive that they actually do have the ability to differentiate into target tissue cells. So while stem cells from bone marrow, from fat, even from umbilical cord, those don't have the ability to actually turn into joint surfaces, for instance, or bone or ligament. Well, the V cells do. The other thing that's amazing about these V cells is they're the only cell in the body that does not experience telomere shortening. So they're just the same age as they were when you were born. And more than that, they excrete telomerase. So they actually lengthen the telomeres of the cells that they come into contact with.
So guys, do you understand how important this is? So I'm sitting here, I'm going to live to at least 180. Harry's one of the guys on my team who helps me do that. And what that means is that these things that are floating around in your blood, you take them out using a specialized technique, you activate them using another technique, and then you can put them where you want them. And the body's like, oh, look, I got baby cells. They're going to make tissues. This is kind of more important than sticking a chip in your head with Neuralink or something like that. Take your existing hardware and make it work better, make it regenerate itself. So you don't have to reprint a robotic heart, just regrow your own heart. That's how big of a deal this is. So this is the ability to hack at a new level. And what Harry's been doing, I think there's still use for it, the bone marrow and things like that. There's growth factors and all in there. But adding V cells in is another level of power that's really happening. I touched on this in Superhuman, but that came out 2 years ago. So what I think we're going to see is you're going to see an explosion in your practice. Talk about the cost. There's several people asking. The whole body stem cell makeover, guys, this is the cost of a nice car. Because you're spending 3 doctors and 4 hours, like you're unconscious, like they go and they do everything. It's like a whole system reboot kind of thing. But you can do stem cells. Like, what's kind of an entry level for stem cells?
Well, you know, like we just said, we did 3 of these in 3 days, and we really can only, you know, we only can do one. Sometimes we can do 2 if we really push ourselves. We usually just do 1 a day because, like you said, it's 4 hours of solid work. But me, you know, a bunch of people running around doing a bunch of stuff. So there's a couple of different levels. There's the 2 hands full body stem cell makeover, which is my 2 hands, and that's all the orthopedic stuff. That's injecting the entire length of the spine, turn you over, both shoulders, both elbows, both wrists and thumbs, both hips, both knees, both ankles, and great toes. That's the 2 hands. 4 hands, which is what I did these last 3 days with Amy Killen. That's where Amy works with me. So it's my 2 hands plus her 2 hands. I do my orthopedic musculoskeletal injections, and she does the skin of the face to improve elasticity and hydration. She does the scalp to thicken the hair follicles. And in men, she does the penis. In women, she does the vagina to improve sexual function. In men, it's primarily to increase microcirculation. In women, it's to increase elasticity and hydration.
It's ridiculous what stem cells do in the reproductive areas. I definitely noticed a difference, and you can pair it with some shockwave therapy that actually changes like size and things like that. But in women, you know, okay, Lana's had a couple kids, and she's a medical doctor. This is my wife. It was a week later. It's like, this is not the same vagina that I'm used to or that she was used to. I mean, it was a really big change and sort of stuff like, how do you talk about that politely? I don't really know. But I can tell you that having, you know, her own stem cells injected there, where you pulled the stem cells out, she hadn't done, her neck was way more mobile. I mean, it was a really big thing. And so there's questions about accessibility. Your insurance company should be paying for this because it is better than the stuff that's much more expensive and harder to do later. Most insurance companies don't pay now, although it's probably possible. But what you can do in the US is you have a health spending account where you can save money that's pre-tax. You can do that. And here's someone who said a knee injury and surgery, and 2 days later, a traumatic brain injury at 75 miles an hour. I could use some stem cells. That's exactly right. You can put them in intravenously. They go throughout the body. I've had a traumatic brain injury. I took a knee to the head at Burning Man. Well, it was worth it. I was doing the Thunderdome thing, and I couldn't remember stuff. Like I couldn't go fish, and I was swearing all the time. I sent an angry email to Tim Ferriss that he didn't deserve, and I apologized for it later when I got my brain back. So what the stem cells do is they go and they find inflammation in the body, they stick to it, and then they secrete healing factors, and it gets better. But when you take the The V cells, they go and they can actually make new cells, which is different. And so they're complementary, which is kind of cool.
Yeah.
Now, I had a question for you, Harry. And the reason I was making noise earlier, sorry, I was too close to the mic. I have here a little bit of you guys know can you guess what that is?
LSD.
Everyone's going to think, LSD, everyone's going to say that this is actually nicotine. It's a nicotine patch. So is nicotine good for stem cells or bad for stem cells? Because I think I'm going to use some for cognitive enhancement and anti-aging.
I do not know the answer. I don't,
what?
I don't want to.
You're the man.
I have a very addictive personality, Dave.
You drink coffee. Come on, I've seen you. I've seen you drink 6 gallons of coffee. You're not addicted. That's just normal.
That's remaining vice. So back off.
So KJ is saying in the UK you don't have access to stem cells. You might be surprised because V cells are treated like platelet-rich plasma because they're just blood. See, this is a big thing. So from a regulatory perspective, it's going to be increasingly difficult for governments who have no right to block you from any treatment, by the way. Any government says you're not allowed to get this treatment, seriously, that is a totalitarian garbage way of behaving. Like, you have a fundamental right to control your own biology. And if you want to remove your left arm because you think it makes you look cool, it's your right to do it, even though it's stupid. See, being allowed to make bad decisions is part of freedom. Right? And being allowed to make good decisions is part of freedom. So when a government says you can't get stem cells, it's like, oh, so you don't work for me, right? Then we have a problem with the government. So I'm going to be straight up forward. It is your fundamental right to choose your treatment, and no government has the right to say you don't get to have that because we don't think it's safe. Well, I didn't ask you, right? And that's how the world works.
Yeah, it's very interesting with this V cell technology, because as you said, you know, with fat, the big issue we have with fat is you take the fat and then you have to put it through a pretty lengthy process. You have to actually enzymatically digest the fat in order to separate the stem cells from the fat cells. And that's where the FDA is saying, oh, stem cell fat are a drug and a non-FDA approved drug. Therefore, practitioners need to stop using it. Well, that case is being litigated currently. That lawsuit is happening between the FDA and my friend, Mark Berman. I think Mark has a really good chance of winning his case. But the issue there, it's the manipulation of the tissue, because you have to take the fat and you have to mix with them. With V,
sorry, it's my fat. I can do anything I want to it, and then I can put it in my coffee if I'm stupid. I could inject. It's my fat. They don't get to say what I do with my fat. And anyone who thinks they do that, it's like, sorry, like, I also own your house. And if I said that, you'd be like, Dave, you don't own my house, but I'm sorry, I do. Right? Sorry, one of us is living in reality, of one of us is not. And I can tell you right now, it's my cells. And if you think you're going to get my cells, you could buy them from me, but they're not for sale. Right? And that anyone, like, there's just no way a government can do that and still have credibility as a government. So I think if the US continues to limit our right to medical freedom, there's going to be a lot of new people in office. A whole lot of new people. In fact, I predict over the next couple of years, there's going to be a lot of people who get their asses kicked out because they destroyed most small businesses because they were doing something, even if it didn't work. That's a different issue, but it's tied to the same thing. Our control over our own biology. It's a big deal. Now, I've seen some questions here from people. One is about repairing nerve damage. One is about whether they've seen anything with autism. And I know what you treat is specifically orthopedic things. I mean, you have, even my wife, who's in emergency room doctor, she saw your needle placement. She's like, wow, his needle placement's amazing when you were putting the needles along my vertebra. So, but what have you seen in literature? What do you know about nerve damage or autism or brain stuff with stem cells?
Well, autism is primarily a disease of inflammation. And there's really no more powerful anti-inflammatory than stem cells. Stem cells excrete cytokines that downregulate the inflammatory response. So I don't treat autism at all. Like you said, I'm low back pain, neck pain.
Yep.
But when I visited the Stem Cell Institute in Panama, one of the main things, one of the number one most common things that they treat there is autism. And it's because, and they believe that it's because of the strong anti-inflammatory properties. When I was there, I met this couple from Colorado who had triplets. Imagine this. They had triplets, severely autistic, all three of them, like violent behaviors. And I mean, as a dad, like, it's heart-wrenching. But they had done a number of treatments with the Stem Cell Institute. And they said with these stem cell treatments, all of the violent behavior in the kids, like, they were still autistic, but the violent behavior stopped. And so their quality of life skyrocketed as a result of that.
So anytime you're treating systemic inflammation, you're going to be doing better off. And the cool thing about stem cells and the new V cells that Harry is working on with Dr. Todd, these are things that go through and they're like snipers. They're finding the inflamed sites and they stick to them and like, here's some healing factors, here's some healing factors, here's some healing factors. So what is Alzheimer's? What is autism? They're all related. It's neurological inflammation, which leads to neurological damage. And in the case of autism, it's usually autoimmune. The immune system is attacking parts of the brain, especially during development. So then the best analogy I've seen is, imagine that you were like a frog in a blender, but not getting blended. But every now and then your face gets pressed against the side and you can see out. But the rest of the time, it's just like swirling whatever smoothie mix around you. And then you can see for a second. So in Autistic Brain, by the way, I had Asperger's syndrome. So I was on the spectrum. I don't anymore. But you don't get enough sensory input because there's just too much noise in the brain. And it's because of inflammation, and it's usually autoimmune, and it's always neurological. What's the cause? There is no one cause of inflammation. There's many causes, and that's why the Western approach to autism, there's no cure. Well, that's because there were 5 causes, and you just had to, they add up, they stack up. What's the cause of aging? It's not one thing. There's 7 pillars in my last book. They stack up. So then if you can fix mitochondria or you can reduce inflammation, what you're getting is everything gets better. And stem cells are one of those fundamental foundational technologies that all of us should have access to through our insurance companies, because it's not that hard to do this at scale. And if we do this, everything gets better. And then you need less drugs and you need less trips to the doctor and you feel better. And most importantly, your brain works better. And when your brain works better, you're nicer to other people, right? So this would be pretty much the way we want to do it. There's cloudy compost pie. Asperger's is awesome, actually. It has its upsides. I recognize patterns better than the average person for sure. I still have that. But the social interaction stuff, I'm relatively normal now. At least that's what everyone tells me. And if they don't tell me, I just punch them and then they tell me so. Okay, sorry. I went back to my Asperger's. So Harry, when people come to see you, like I did, if they're doing a knee or a single joint and all, that's what, a couple hour procedure?
Mm-hmm. That's right.
Okay. And if you're doing the whole body stem cell thing like I did, that's pretty much most of a day. And then the next day or two, you're chilling out and recovering and all that.
It's a huge commitment because taking a half a liter of blood. So, there's quite a bit of blood loss. So people are pretty out of it. We very strongly people basically, we demand that they go straight back to their hotel, have someone with them and recuperate.
All I wanted was steak. It was weird. After I had my treatment with you, I literally was craving bone marrow, which is not something I crave. I like bone marrow on steak, but my body was like, eat bone marrow. So I went to a restaurant. I'm like, do you have any bone marrow? And you can actually get bones that are split with roasted bone marrow. So I had like this giant grass-fed steak, and my body was like, regenerate. So I listened to my body, and I ate so much steak. It was so good.
Yeah. So it's a huge commitment, but it's something, it's not something you do every year. It's something you do. It's something that like, people often say, well, Dave Asprey said he's going to do it every 6 months. No, not quite.
No, I would never do that. Would be not enough recovery. I would do this like every several years. Well, would I do an IV stem cell every 6 months? Yeah.
But that's what you said. You said you would do IV stem cells every 6 months, but I think people misinterpreted that.
This is a substantial procedure. I mean, it's 4 hours of people doing all kinds of work. I don't think that would be medically, even if I could afford it, I don't think that would be medically the right thing to do. I mean, if someone...
You wouldn't want to do such a big bone marrow aspiration so frequently. I mean, I think this large blood draw has a therapeutic effect in itself because it's essentially therapeutic phlebotomy. You're losing a bunch of red blood cells, growing, essentially making new ones, which are softer and more pliable and better viscosity and the whole thing. But theoretically, every time you remove the stem cells from the bone marrow and they have to self-replicate, then the telomeres are going to a little bit. So if you do it over and over and over, you're theoretically shortening your telomeres. Do it once every 5 years, especially once we start incorporating the V cell, which is going to have the reverse effect. It's going to lengthen the telomeres. I think that's a huge addition to my kitchen sink approach. Bone marrow stem cells plus fat stem cells plus placental exosomes plus the very small embryonic-like stem cells, which are taken from the blood. And what's amazing is the other method that I had, that I was going to learn how to do, involved freezing and thawing the blood, because that you stress out the blood to activate these. It's very time, like 6 hours to do this. Well, Dr. Todd, he's come up with a laser, because he's an MD, he's a John Hopkins pulmonologist, but also a physicist, and he's developed a laser to activate these V cells. Use the laser to activate the V cells and inject them into the body, and then immediately follow the injection with pointing the laser right at the place you've injected.
That is a really interesting thing to be able to guide them. So I think you guys are all going to see, you're all going to see that the ability to do this becomes much more commonplace over the next 5 years. But you're one of the first people out here, Harry, who's going to have access to this technique. And I know Dr. Todd as well, and I'm helping him out here.
Production, I'm very grateful for it.
Oh, of course. It's part of my job in the back channel here is to take the people doing the most cutting edge work and connect them all if they're not already connected. And as you know, like there's a tribe of probably a few hundred really strong medical innovators, and we're all sharing stuff behind the scenes and talking with each other and all working to bring the future into the present. Because otherwise it takes a whole generation of doctors dying before the new ones come in and take advantage of knowledge. So we're speeding up the knowledge and the distribution of it and the awareness. So everyone listening on Instagram right now, like, oh, this is possible. I didn't know this was possible. Why didn't someone tell me? And more importantly, why didn't my doctor tell me? Well, it's because your doctor might not even know this exists, or they don't believe it's possible. And we get into this, that can't be, therefore it isn't, which is not science. That's actually the height of ego. And here we've got a guy, Harry's been doing this for 20 years, going, guys, this is real. Look at my patient results. Look at what's happening here. And I'm seeing people say, look, how affordable is this? It's more affordable than most medical procedures you would have for a major joint injury. Like if you're going to go in and get a knee repair or a new knee or a new hip or a new whatever, but no, it's not cheap. You're talking about a full surgical theater, a 3D x-ray, a well-trained doctor, all that kind of stuff. So no, it's not particularly cheap. Is it affordable compared to the alternative? Yeah.
The way I do it is expensive if you choose the number. But if you actually look at what we're doing, there's so much value. Most people, you can get stem cells for $5,000 in your knee or something, but usually it's umbilical cord stem cells injected by a nurse practitioner who's not even using any kind of image guidance or anything. What we're doing is bone marrow combined with fat, combined with exosomes, soon to be V-cell. It's done all under IV sedation by a board-certified anesthesiologist, and every injection is image guided, either with x-ray or ultrasound. So yeah, it's expensive. I mean, a single joint is around $15,000. 2-hand full body stem cell makeovers, $35,000. 4-hand full body stem cell makeovers, $50,000. What you had, I'm not even going to quote. If you have to ask,
but here's the thing: you're flying a Johns Hopkins neurosurgeon from Johns Hopkins because they're putting stem cells inside your spinal cord. Guys, normal people don't do this.
Right.
I was writing a book on what the billionaires are doing to live forever, so that I could make it known, so that we can all have access to it. So this is about driving awareness of the very cutting edge, which is where Dr. Harry is capable of going, where he goes sometimes. But it starts at 10,000, 15,000, somewhere around there, when you're going to come in and have your own cells versus cells from some pregnant person somewhere, actually 8 pregnant people somewhere. So this is how I would prefer to do it. But if I was limited in budget and I was looking at, I could get a knee surgery. I've had 3 knee surgeries, by the way.
Dave, let me interrupt there.
Yeah.
Actually, for people who can't afford it, because no matter how great this is, it doesn't do anybody any good if they can't afford it, which is why I created the Tithing Program.
Yeah. Talk about that, Harry. You're a good guy the way you do this. I respect that so much.
So we started the Tithing Program about 3 years ago, and 1 day per month, we perform stem cell procedures at no cost to the medically underserved. And if you go to my website, under services, it says Tithing Program. You can look up the guidelines, but essentially there's 2 pathways for entry into the Tithing Program. First, we determine that somebody's living below poverty line. So we just ask to see your tax returns. Once we've established that, we will treat combat service veterans at no charge. You know, they've done their service. I'm happy to do it for free. If you're not a combat service veteran, I will do the treatment in exchange for between 60 and 100, depending on what we're doing, community service hours. And because, you know, I don't want to do the treatment just for free because people won't take it seriously and they won't, you know, they're not emotionally invested in it. But if they have to go do between 60 and 100 community service hours to do the treatment, people take it very seriously. So we've been doing it coming up on 4 years, and it's fabulous. I mean, it's so enriching to me to do. And if there's any doctors listening to it, I invite you to look at my website, see how I've got it set up, and start doing it, because it's you know, it's just win, win, win. Everybody wins. It's terrific.
And it's funny. There's a comment here from Jen saying, "Oh yeah, we'll never be able to have access to Billionaire Forever Young and Living." Here's the deal, guys. If you go back to when I was a teenager, which is not that long ago, a cell phone was going to cost you $40,000 and took up the whole trunk of your car, and it was $25. By the way, $25 back then is $75 now. Okay, so per minute. And you'd only see like Hollywood producers and Wall Street people with their Rolls Royces and whatever, and people would get all mad at them because who do you think you are? Okay, now you probably have a cell phone that's way better than the ones I had back then, and it didn't cost you $40,000, right? So there is, over the course of time, as awareness happens and as these techniques come out there, they should become part of the medical system. And that's what we're working to make happen, a common and accepted part of it. So the fact that I'm going out and I'm doing this stuff now and a few other people are doing it, that's what creates the ability for all of us to do it over a longer period of time. And that's why you should be happy that, you know, the Sergey and Larry and all of these other billionaire people are out there pouring billions of dollars into research. And sure, they're getting the advantages of it first. Who do you think had the first car? A billionaire, by whatever the first car standards of billionaire were back then. So it percolates, and it's our job to make the percolation happen faster and make demand happen faster. And every time you go to your doctor and say, what about stem cells? You're actually helping to make these accessible to everyone. In the meantime, if you think it's not possible for me, look at what Harry's doing. 10% of his time, he's giving it to people who need it, who have served, right? And there's no reason other doctors can't do that. When I was 21, and I had the second time my knee failed, I would fall over and I was walking just through campus. And I went back to the doctor, the surgeon, and I said, you know, I'm gonna have to take a semester off of college to pay for this. I'm just gonna have to work and I'll be able to come back. And he's like, no, Dave, that's not fair. I want you to go to college. I'll do your surgery for free, because it was need-based, right? So it is possible. If you are desperate and you're doing all that you can do, there are people, including medical professionals, who wanna help you. Right. So don't look at any of these things and say, I'll never have that, because the future is unpredictable. And because good things happen to good people, keep helping other people and experiment, explore, and look around the world, and things are possible. So I want you guys to stick with that. We're going to talk about the crazy stuff, the stuff like Harry's saying. I'm even going to quote the 6-hand thing, because few people are going to fly in a neurologist or a neurosurgeon from Johns Hopkins. I did it because I was writing a book about it. But, you know, you don't have to do that. But don't, Jen, tell yourself that you'll never have access to these, because right now you're watching this on a device that no one could dream of 30 years ago. This is only 30 years, and only 30 years. Yeah, people live like 100 years, right? You get like 3 of those in your lifetime. So stem cells, they're freaking cool. They're happening now. Harry's a leading guy who's done huge amount of work on me for those. I want you to know this is possible, and now you know, right? That's what this is about. Harry, thanks for your work at Docere. People can follow you here on Instagram, but where can they? What's your website?
Well, the website is docereclinics.com, DOCERE clinics.com. If you just follow me here on Instagram, and then, you know, go to the bio or whatever, you can link through. But I would invite people who want to learn more to see my film, which is solutionfilm.com. And it's a 60-minute Nick Nanton film. Got a bunch of other people, Jim Quick and Vishen is in there, and we got a bunch of other people in there. But it's a 60-minute film that sort of just tells my story about how this all came about, and then it goes into some real depth about some patient success stories, the evolution of whole body stem cell makeover, and the evolution of the Tithing Program.
Well, You're doing good work in the world, and you did good work on pretty much every place it can be done in here. And I'm sorry we didn't get your colleague here, Amy Killen, who did the work on the other parts, because it would have been even more funny. People can find the film. What's the URL for the film?
Yeah, I was going to put it in the comments, but I'll just go ahead and say it again. It's stemcellsolutionfilm.com.
There you go, STEMcellsolutionfilm.com. And that's definitely a film worth saying. So you guys are interested in this, regenerating the human body, understanding what can happen if you had an injury like I did in my teens and 20s, the knee problem I've had. I am more mobile, more flexible, stronger, smarter, faster, measurably now than I have been for many, many, many years, even than I was as a 20-year-old. So it is possible, it's doable, and it works. And for me, stem cells were a major part of it. And Harry's done the heavy lifting for me. Guys, I hope you enjoyed this. Harry, thank you for all of the work that you're doing. It's awesome. And I'll see you soon for some more cells.
That's right, Dave.
See you guys.